Hey guys, I'm Chris Galucci, and for my community-based participatory research case study, I chose the Transgender Community Health Project. The transgender community consists of individuals who may self-identify as transsexual, transvestite, intersex, bigender, male, born female, or female born male. Transgender persons are often subject to stigmatization, which can make it difficult to obtain employment, housing, and healthcare. These difficulties most likely increase the financial stress in the community and may lead one to speculate that this can be a possible reason behind any contributing factors to health risk behaviors. Unfortunately, there's been a lack of epidemiological data that has not allowed for researchers to study this community and address any possible health disparities, which is largely due to the standard binary male female gender categories typically used during surveys and data collection, which makes it difficult to stratify data based on this population. This has posed a problem in that the transgender population has often been overlooked, creating what the authors have called a hidden community. Back in the mid-90s, this lack of data frustrated a group of transgender individuals enough that they decided to attend several San Francisco Health Commission and Department of Public Health meetings in order to vocalize their concerns over a need for transgender risk behavior in HIV studies. Due to the persistence, the San Francisco HIV Prevention Planning Council finally made these studies a priority, with researchers asking the community members to collaborate in developing a research grant application, which was finally approved and funded in 1996. So this study sought to analyze and address access to health and prevention services, as well as the psychosocial issues within the San Francisco transgender community, with the primary goal being to obtain an estimate of the HIV prevalence and the risk behaviors among this target population. In order to achieve these goals, a community academic partnership was formed upon the funding approval, where an additional 10 male to female and 10 female to male transgender volunteers were recruited to conduct formative research for the study, which consisted of 30 key informant interviews, 11 focus groups, and 4 months of ethnographic community mapping. In 1997, the 24-member community advisory board, consisting almost entirely of transgender individuals who were homeless, current sex workers, healthcare or social service providers, were recruited through street outreach and by writing letters to agencies that served the transgender community. The Community Advisory Board met monthly to develop protocols, sample plans of data collection instruments, to interview and hire the research team, develop transgender-specific education and referral materials, and oversee participant recruitment and data collection activities. Some members worked with researchers to help develop culturally appropriate ways to ask sexual behavior questions. 6 transgendered individuals were hired as research associates to help finalize study instruments and were also responsible for the recruitment, interviewing, HIV testing, referrals, and presentation of the study results. In terms of the community-based participatory research approach and methods, this study was heavily community-driven and followed the principles very thoroughly. CBPR basically is participatory and cooperative. As mentioned earlier, this project was initiated as a result of the persistence of a few transgender individuals who saw a need for the community, took the appropriate steps to bring awareness to the proper channels, and eventually were acknowledged. Outside researchers were brought in to assist and work with the transgender community to address their needs, rather than the other way around, where researchers identify a problem and recruit community members. Throughout the entire process, community members were heavily involved and worked with researchers rather than for the researchers. Also note that this is a co-learning process. Both the researchers and the community members had different knowledge and skills and were able to learn from one another. The community members are trained in technical research skills such as counseling, interviewing techniques, ethics, infection control, and suicide prevention, while the research team were made aware and trained in the importance of self-identity and the psychosocial reasons for risk-taking within the transgender community. Cross-training also occurred between the male-to-female and female-to-male community members, where both gained a better understanding of each other, which helped to inform the development of sampling frame, questionnaire, and data analysis plan. CBPR also involves a system development and empowerment. Lessons were learned and methods were developed from the study that were applied to some of the community advisory board members to develop new or to improve existing interventions at other agencies. In this manner, individuals at those other agencies gain new tools and knowledge, thereby giving a sense of empowerment to both the agency as well as the members presenting the information. Additionally, the study provided feelings of community ownership and pride for the community advisory members in that they felt that they were making a difference and being taken seriously instead of being marginalized as they were used to feeling. The skills obtained and feeling of empowerment from the study led research associates to become guest lecturers at universities and conferences, as well as open doors for them to pursue higher employment. Also to note with the study, there is a balance between research and action. One of the hallmarks of participatory research is a commitment to action, which stems from the lessons learned and information obtained during the research processes. The Transgender Community Health Project not only obtained their goal of estimating the HIV prevalence and risk behaviors, but the results had future implications that led to action that improved other projects and policies. The formative research in the study consisted of 30 key informant interviews, 11 focus groups consisting of 100 transgender individuals, and 4 months of ethnographic community mapping. Now, ethnographic community mapping allowed the Community Advisory Board to identify neighborhoods where HIV testing and interviewing were to be conducted. The board felt that it was important to rotate recruitment across these neighborhoods in order to ensure diversity of participants as well as to facilitate referrals to these agencies conducting the interviewing and HIV testing. The 6 research associates who were recruited to help finalize the study instruments noticed that many of the agencies which they referred participants were insensitive to the needs of the transgender individuals and therefore planned to conduct in-service training sessions for those agencies and clinics. They also worked closely with the Community Advisory Board in order to develop transgender-specific HIV education and referral materials that address specific issues such as how to inject hormones safely, as well as the importance of self-protection via condom use. Throughout the research process, the community members had equitable control and played a valuable role in helping refine materials and communication techniques relating to the transgender population, which led to the study being very well received and successful in obtaining its objectives. However, during the quantitative analysis phase, community involvement began to wane as some community advisory board members felt alienated or uninterested, and therefore decided that they trusted the health department researchers to code and analyze the data and would only meet quarterly to interpret the results and help guide data dissemination. Just looking at some of the results from this study, in total, 392 male to female and 123 female to male transgender persons were recruited, interviewed, and tested for HIV. 35% of male to female participants were infected with HIV versus only 2% of female to male participants. Factors that increase the risk for this HIV infection included being African American, having a history of injection drug use, having multiple sex partners, and being less educated. 2/3 of male to female and 1/2 of female to male participants classified as depressed, while 32% of each had previously attempted suicide in the past. Now, this is just some of the data that was collected. If you're interested in more specifics, the website I posted below, there's a link at the San Francisco Department of Public Health website that gives all the information that was discerned from the study. It's actually pretty interesting if you want to look at that in your own time. So the results that I just showed you guys in the last slide, first they are presented to the participants, collaborating agencies, and various HIV councils, and then a large community forum was planned by the Community Advisory Board in order to present the study results to the population. The research associates and advisory board members participated in every presentation and offered program and policy recommendations based on their review of the data. This had far-reaching effects that went beyond the information the study obtained, in that it resulted in the development and implementation of new programs for transgender individuals. Results have been used by human rights groups to argue for improved health care and increased discrimination protection, as well as the San Francisco Health Service Board used the data and materials in making its landmark decision to offer transgender health care to city employees, and this includes gender reassignment surgery. The methods and materials that were developed were used across a number of other projects that aren't exclusive to transgender research, as well as the research associates are still involved in research and health services for transgender persons, with some pursuing advanced degrees in health-related fields, as well as their community collaborators who continue to work with the San Francisco Department of Public Health to this day. Now, this study really was a hallmark for CBPR type of research, and that this study was driven by the community members in almost all aspects. So that includes funding, ethics, program design, development, implementation, review, and dissemination of findings. As I mentioned, the only aspect in which the members chose not to participate was the quantitative analysis phase. However, this did show that they had gained trust for the health department researchers, which is also a vital aspect of CBPR, creating that trust between the academic researchers and the community. This transgender community health project set a precedent for the CBPR in terms of illustrating and proving its effectiveness, as well as it opened a lot of doors for the transgender community, such as new funding for tailored HIV services, new behavioral risk assessments, educational materials, but more importantly, resulted in the adoption of new categories for gender classification by some agencies. And there's actually still lobbying to try to get some of these gender classifications on some federal surveys, such as the CDC. From the start, the community members were heavily involved in the project, making it a collaborative effort and leading to the study being very well received by target population as well as academia and a number of HIV councils who were involved in the study, thereby creating a community academic partnership that was highly relevant and successful. I encourage you guys to take a look at this study if you are more interested in it. Below I posted the references if you would like to read it in full.